People in BC do not have equitable coverage to osteoporosis medication treatments as those in other parts of Canada. Providers who prescribe therapies to prevent fractures must spend time filling out forms and helping patients navigate coverage for treatment. We must take action to change this inequity.
Welcome, Dr. Karani. People in BC have told me that they can't get coverage for therapy to prevent breaking a bone, even though they're at high risk of a bone fracture. That doesn't seem right. Can you provide some details?
It's unfair that in BC, people who have been assessed at high risk of fracture do not have any publicly funded options. Currently, a person in BC has to break a bone first in order to get medication coverage. Once the fracture occurs, they go to their provider, who would then send them for x-rays and fill out a form to apply for coverage. Only then is their coverage available. Even after meeting the criteria, there is further delay in starting treatment due to the processing of paperwork and unnecessary tests, which takes up the provider's valuable time. Other provinces in Canada do not have this restriction, and the provider can prescribe a fracture prevention therapy to people who are at risk for fracture without paperwork or additional tests.
How are patients impacted by this policy?
It definitely impacts their health and wellness. Why would a patient want to have a fracture first before they can get a medication that can help prevent fractures? Many private drug plans won't even cover these medications if pharmacare doesn't. Naturally, patients are frustrated and often are left feeling helpless because they can't access these important preventive measures until they have a fracture.
I understand there are many options to treat people who have a high risk of bone fracture or osteoporosis. How does BC coverage compare to other provinces of Canada?
Osteoporosis treatments are more available in other provinces. Many of them have simpler criteria to access options for osteoporosis treatment. There are medications that can prevent fractures that can be self-injected under the skin as an intravenous once a year, or even other oral medications that are just easier to take. These are accessible in most other provinces with the simple criteria of being at high risk of fracture. The question is, why are BC patients being left behind? Why are BC patients not receiving equitable access to these important preventive medications like other Canadians?
Aren't there other conditions where a person at risk of an adverse health event gets preventative therapy covered?
Some good examples of this are people who are at high risk of stroke with high blood pressure. They have several blood pressure medications without any paperwork required by the care provider. Patients with diabetes can also receive a variety of treatments to control blood sugar that are publicly funded without any paperwork. In contrast, patients with osteoporosis without a fracture have no options for pharmacare-covered treatment, even if they are at high risk of fracture.
What's the cost to the medical system and patients by not having access to these preventative medications?
Fractures are costly. Patients with these fractures take up beds in the emergency department, the hospital, and long-term care. From a patient's perspective, having their first fracture diminishes their quality of life and puts them at greater risk of future fractures. We absolutely need to give those that are frail in our society a chance to avoid being in hospital. An example of this are the consequences of hip fracture. People end up in hospital, lose their mobility and their independence. Many seniors want to stay at home as long as they can. Assisted living is a big step and permanently impacts their lives, making them more and more dependent on others. We can prevent these consequences with treatment before people fracture.
What's the action that needs to take place to change all of this?
First of all, the Ministry of Health needs to improve access to treatment in preventing the first fracture. There needs to be equitable care for osteoporosis in British Columbia compared to other regions in Canada. We want the BC government to vote for equitable access to osteoporosis medication. Our call to action is for the Ministry of Health to improve the overall access to treatment in preventing the first fracture. We demand equity for osteoporosis care in BC.